Welcome to Medical Student Life in Japan, a podcast created by a teacher and a group of medical students at Nara Medical University.
We are a small medical college in the Kansai region of Japan. This podcast has two great purposes.
One is to share stories about being a medical student here in Japan.
And also for our students to share fun ideas, opinions, and information about Japanese culture to people all over the world.
Thanks a lot for listening. Okay, welcome back to Medical Student Life in Japan. And today we have a special guest, Yuka, 4th-year nursing student. Nice to see you again.
Nice to see you again.
Yeah, so our audience, of course, you remember Yuka. She's been on the podcast a few times over the last few years, but recently she was away from the class. She wasn't skipping class, but she had a reason why she was away. And what were you up to, Yuka, over this last month or so?
I'm nursing student, and nursing students have to go to nursing training in hospital or other place. And in my university in June, 4th-year nursing student went to final nursing training.
Okay. And so just for our listeners' understanding, nursing college in Japan is 4 years. And so you're in your final year.
Yep.
So you're kind of near the end of your study.
Exactly.
Yeah. And then this 1 month that you spent is the final training.
Yes.
For that year. Okay. So can you tell us a little bit about the experience?
Of course.
Okay, please go ahead.
My nursing training started 4 years ago. It means when I was first-year student.
Yes.
When I entered this university, Nara Medical University, teacher said nurses should be kind to patients. But I wonder what is to be kind.
Okay.
I understand the vocabulary, of course, but I can't understand the behavior. So first year and second year, my nursing student life, I can't understand. But third and fourth nursing student life, I learned a new idea.
I see.
In Japan, to be kind is said omoyaru. In English, to sympathize with some people.
I see.
In nursing department, to sympathize with patients. But what is to sympathize?
Yes. Yes.
For the first time, I think when to image if I'm the patient. But I'm not patient, and everyone have each own feeling of value. So there is difference to nurses and patients. Of course, patients to patient. So to image if I'm the patient might be wrong.
I see.
But I get idea.
Okay.
To think from patient side, it means respect their feeling of value. For example, when patients tell nurses that I have pain, when in this case, patients use all medicine to reduce pain, so nurses can't do anything to patient. So if nurses tell patients that we can't do anything to you just because we have already used all medicine, but if nurses telling patients that patient will feel lonely, no one can help me. But if nurses think from patient side, nurses can say that that's too bad. Sorry, we can't use any medicine. So, but please tell me, how is your pain? And listen to patients talking. In fact, nurses can't reduce their patients' pain, but patients can tell, nurses can listen to patients talking, and patients feel I'm not lonely. I have good nurses, so their stress will be decreased. So this is to think from patient side.
Oh, that's good. That's really good. I hadn't been into the hospital so many times personally, but several years ago, I had a kind of accident and I had to spend some time in the hospital in my room. And they did, many checks, physical check, x-rays, and many other things. And related to your experience now, I was the patient, and the nurse is the one who usually comes to check on me. And in that situation, the most important thing was to have someone to talk to for me, someone to talk to. As a patient, you're a little worried. You don't know exactly, am I okay? Is everything okay? And you might feel a little nervous or anxious. And so I remember from that experience, just the nurse coming in to check on me and doing the things you're talking about made me feel a lot better. Reduce my stress a little bit, or my anxiety about the situation. And so I think you learned a really valuable lesson. In pain, actually, I was in a lot of physical pain at the time, but I did notice, physical pain can be controlled mentally. Sometimes pain feels like it comes and goes. It's more painful at times and less painful. But by talking to someone and having someone listen to me, I could feel actually a lot better. So I think even though you said you may not know exactly how they're feeling, listening to them and talking to them can have a great effect. I think that's a good lesson that you learned.
Thank you.
From that. Was there anything else from your experience that now that you're done with that 1 month, that you look back and reflect on about that? Are there any other interesting experiences?
I have one new idea.
Oh, okay, good.
When nurses or nursing students listen to patient talking, repeating is important. Also important. For example, when patients tell nurses or nursing students, I have pain, I can't endure. And when nurses repeated, you have pain and you can't endure the pain, and patient will say exactly. And in this conversation, nurses accept patient talking. Nurses cannot solve the pain itself, but to repeat patient talking means by repeating patient talking, patient will feel this nurse can understand me. So I want to talk about more other thing and step by step relationship between patients and nurse
gets closer.
Yeah.
Gets closer. Okay, more comfortable, more connected.
Yeah. Thank you.
Yeah. No, that's great. Yeah, that's really important. In some of our classes here at the university, this kind of topic comes up, of course, because we have medical and nursing students. So some of even in the English classes, we're talking about the relationship with the staff and the patient. And one of the things they mentioned in one of the articles was about repeating what the patient says, kind of confirming what they say. So the patient will say something, and all you need to do is repeat or confirm. And then that allows the patient to know that you're listening closely and paying attention to them. Because sometimes it may feel that the doctors or the medical staff or hospital staff are so busy and they're too busy for one patient, but by doing what you practiced, it gives them a sense of value that, okay, I'm a person and they're paying attention to me and they care about my well-being. And that can have a strong positive effect on their condition too. Yeah, so that's great. Okay, so now you had a one month in this training and you learned some new lessons. And as we talked a little bit before recording, as a nursing student, you don't get to do so much technical practice during this 1 month of training, but you learn valuable human life skills and human relationship skills as a nurse. So that's really great. Now we're at the end of June. And so what do you have left going forward for this year in nursing college?
Now we have nursing research.
Oh, okay.
For graduation. And next February we have national exam for nurses.
Okay, so you're doing some research and then studying for the exam.
Yeah.
Okay, and so the next do you get a break? Do you get like a summer break?
Yes.
Okay, so you have a little time to relax and
of course.
Yeah. And I remember, Yuka, you're probably going to be watching some movies.
Yes.
Which I know is your hobby, right?
Yeah.
I think I remember you liked Titanic, was it?
I love.
Yeah. So maybe watch some movies and enjoy the summer, and then from the fall study hard for the national exam, and then by February or March, graduation, and then you'll officially be a nurse.
I can't believe it.
It's so fast because I think I came up in this podcast before, but I taught you in 2nd year. You were in my class, so yeah, and then time just went by so quickly.
Exactly.
So I guess my advice to you is enjoy the rest of your student life. Yeah, this is an important time, and of course, once you become a professional, that'll be great, but it'll be hard and you'll be very busy. So make sure you enjoy your time as a student.
Thank you very much.
Okay, thanks a lot, Yuka.
Thank you.